that sharp ache in your knees and stiffness in your hips every time you stand up from your favorite sofa doesn't mean you should stay completely still to protect your joints. In fact, your knees might simply be missing the vital support of a stable pelvis and strong core muscles. Today, Sophia will guide you through a gentle, slow, and safe routine right here at home to rebuild that foundation. We will not rush or force anything. We will move with total control. If you feel a sharp pain, dizziness, or shortness of breath, please stop immediately. Your safety always comes first. Now, let us get ready to begin. Find a comfortable spot next to a sturdy chair or a solid wall. Stand tall with your feet hip-width apart. Rest your hands lightly on the back of the chair for balance. Relax your shoulders and look straight ahead before we begin our movements. Let us make sure your practice space is completely safe. Check your chair right now. Must be heavy and steady, placed on a flat floor that is not slippery. If you are on a wooden floor, a thin rubber mat under the chair legs can prevent any unexpected sliding. Make sure there are no loose rugs, cords, or clutter around your feet. As you stand tall, wear supportive shoes with good grip, or keep your bare feet firmly planted on the ground. Throughout this entire session, remember that your breath is your best guide. Never hold your breath. Let it flow naturally, in through your nose and gently out through your mouth. Listen to your body. If a movement causes any sharp discomfort, simply reduce how high you lift your leg, or just pause and rest. We are here to protect your joints, always Dravi. You ever notice that when you climb a flight of stairs or try to step over a small curb, foot feels heavy, almost as if it is dragging? You might think this is just a natural sign of aging or a general lack of leg strength, but the real issue often lies deep inside your hip. Your hip flexor muscles, which are responsible for lifting your leg forward, might simply be asleep. Many people try to force their foot higher by leaning their upper body backward or twisting their torso. But this false movement actually strains the lower back instead of strengthening the leg. Biomechanically, lifting your leg is a crucial part of the swing phase in walking. Think of your hip flexor as a gentle crane, pulling the thigh upward while your opposite leg acts as a solid anchor to keep you perfectly steady. To do this safely and correctly, let us practice what I call the stepping crane method. Stand tall behind your sturdy chair with your feet hip-width apart and your toes pointing directly forward. Rest a few fingers lightly on the back of the chair for balance. Hold your chest open and your standing knee soft. Never lock it now. Brace your stomach gently to protect your lower back. Flex your chosen foot so your toes point slightly upward toward your shin. Slowly lift your entire leg straight out in front of you. Only lift it as high as it feels comfortable, keeping it well below 90 degrees. Hold for a brief second, then lower it back down to the floor with total control. We will begin with a very easy version. Lifting the foot just a few inches off the ground. As you feel more stable, you can gradually increase the height. Let us perform 5 to 8 gentle repetitions on this side, and then we will switch legs. Remember my favorite rule for this movement. Lift with the hip, keep the back quiet. If you feel a sharp pinch in your hip or throb in your lower back, please reduce the height or stop right away. Now, think about when you are walking down the street or standing at the kitchen counter. Do you ever feel like you lack the power to push yourself forward? Or do you notice a dull ache creeping into your lower back after standing for just 10 minutes? You might believe that this discomfort is simply a sign of a weak spine, or that the solution is to force your legs back as high and as hard as possible when you walk. However, the real issue often isn't your back at all. It is an inactive gluteus maximus, the largest muscle in your buttocks, which is responsible for stabilizing your pelvis and driving your stride forward. Swinging your leg back forcefully might feel like a good stretch, but without strict control, this rapid movement becomes a false friend. Instead of using your hip, your body compensates by arching your lower back, which pinches your lumbar spine and causes unnecessary pain. Biomechanically, proper hip extension opens the front of your hip while your core acts as a solid shield to protect your lower back. To retrain this movement safely, I will use what I call the anchored motor protocol. Keep both hands firmly resting on the back of your sturdy chair, stand completely upright, and soften your standing knee. Now, keeping your lifting leg completely straight, slowly glide it straight back behind you. Only need to move it a few inches off the floor, just until you feel a distinct squeeze right in the center of your buttock. Do not lean your chest forward and absolutely do not let your lower back sag or arch. Inhale deeply as you hold this gentle contraction for 2 seconds. Then exhale as you lower the foot back down with total control. If you have a history of back pain, spinal stenosis, or a hip replacement, a tiny movement of just 2 inches is your perfect, safe starting point. Let us complete 8 to 12 slow repetitions on this leg. Keep your lower back completely quiet and let your glutes do the driving. If you feel any strain in your spine, reduce the range immediately. Let us smoothly transition to our third movement, focusing on the sides of your hips. Think about when you step out of a car, walk sideways down a narrow hallway, or lose your balance when stepping over a small pet. You might feel your body sway heavily to the side and assume that your joints are simply becoming stiff with age. But the real issue is often a quiet stabilizer on the side of your hip called the gluteus medius. Many people try to fix this by lifting their leg as high as possible, leaning their entire upper body to the opposite side to force the leg upward. This extreme leaning is a false friend. It completely bypasses the hip muscle, pinches your lower back, and forces your standing knee to buckle inward. Biomechanically, your gluteus medius acts as the architectural stabilizer of your pelvis. When you take a step, it holds your pelvis level, preventing your hip from dropping like a tilting ship. Let us do a quick 5-second check right now. Stand on one leg and notice if your hip immediately pops out to the side or if your standing knee caves inward. If it sways, your side hip needs proper activation. To fix this safely, we will use the lateral stabilizer protocol. Stand sideways next to your sturdy chair, resting one hand lightly on the backrest for absolute safety. Keep your posture tall, your chest open, and unlock your standing knee. Now, slowly sweep your outer leg directly out to the side, aiming for just 30 to 45 degrees. The key condition is to keep your torso perfectly upright. Do not lean away from the leg. Hold for a brief second, feeling a deep, warm squeeze on the outside of your hip. Then return the foot to the floor slowly. If you have hip bursitis, severe arthritis, or a joint replacement, use our easiest version. Glide your toes lightly along the floor without lifting the foot at all. For the medium version, lift a few inches. If you are steady, hold the lift for 3 seconds. Let us complete 8 slow repetitions on this steady. Remember, stability first, height second. If you feel any sharp pain in your groin or outer hip, reduce the range or rest immediately. Now, let us try a very precise variation of our side lift. Think about those times you walk on a sloping driveway, step onto a curb, or feel your foot suddenly turn outward, making your walk feel loose and unstable. You might think that to keep your legs moving straight, you just need to pull your feet up higher, or turn your toes outward to get more leverage. But true control of your stride does not come from pushing outward wildly. It comes from a hidden, subtle rotation deep inside your hip socket. Forcing your toes to point upward or outward might feel like you are getting more range, but it acts as a false friend. It overuses your front thigh muscles, bypasses the side hip entirely, and can actually twist your knee under pressure. Biomechanically, think of your hip joint as a precision steering wheel. When we turn this wheel slightly inward, we activate the deepest fibers of your side hip muscle, creating a strong internal guide that keeps your knee perfectly aligned. To practice this safely, we will use the steering internal reset. Stand upright by your steady chair, keeping your shoulder blades relaxed and your standing knee soft. Slowly lift your outer leg to the side, about 30 degrees. But here is the essential condition. Gently rotate your leg inward from the hip, so your toes point down toward the floor and slightly inward toward your standing foot. Keep your upper body perfectly still. Do not let your hips or chest twist with the movement. Breathe out gently as you lift and turn. Hold for 1 steady second, then inhale as you lower the foot back down with total control. If this feels too challenging for your balance, use our easiest version. Keep your toes resting lightly on the floor. Slide your foot out to the side, and simply practice gently turning your heel outward. Let us complete 5 to 8 slow repetitions on this side. Of a total hip replacement or feel a sharp catch in the joint, please skip the turning motion and return to the basic straight side lift. Keep the movement small, slow, and precise. Imagine walking in your yard, turning to step over a hose, or stepping diagonally around a table in your living room. You might feel a heavy tightness where your lower back meets your hip, and assume that your joints are simply becoming stiff with age. To clear the path, you might try to force your leg into a high, wide diagonal kick. This aggressive kick is a false friend. It completely jams your lower spine and strains your knee joint without engaging the proper muscles. Biomechanically, this diagonal movement requires a perfect harmony between your rear glutes and your side hip muscles. Think of these muscles working together like two sturdy cables acting as a shock absorber to protect your lower joints from the harsh impact of the floor. Let us master this combined movement safely, using the upright next to your stair. Keeping your shoulders relaxed, your chest wide open, and your standing knee softly bent. Take a deep breath in. As you exhale slowly, lift your outer leg back at a soft 45-degree angle, diagonally between a straight back extension and a straight side lift. The essential condition here is to keep your torso perfectly upright. Do not lean forward or arch your spine to force the leg higher. Hold for one brief second to feel the back and side of your hip tighten, and lower it down with total control. For our easiest starting point, keep your toes touching the floor and gently slide your foot back along a diagonal line. For our medium version, lift your foot 3 inches off the floor. Let us complete 5-8 smooth repetitions on this side. Remember our golden rule. Your body adapts to what repeats. To keep your hips strong, simply remember 3 simple actions. Lift forward to step, extend backward to stride, and diagonally to absorb every shock. Always listen to your body. If you feel a sharp pinch in your lower back or deep hip pain, stop immediately and rest. We just practiced the diagonal absorber move. Now, let's take a brief moment to understand why this specific area. The side of your hip is the ultimate key to your daily mobility and balance. In medicine, we call this muscle on the side of your hip the gluteus medius, but you can simply think of it as your body's internal architectural anchor. Every single time you lift one foot to take a step, climb a stair, or get out of bed, your body is completely supported by just one leg for a brief moment. During that split second, an anchor on your standing hip must contract to hold your entire pelvis level. If this side hip anchor is weak, your pelvis tilts downward like a loose balance beam, causing your torso to sway back and forth as you walk. But here is the most important warning your body gives you. When your side hip anchor falls asleep, it forces your knee to pay the price. Without a stable pelvis above it, your standing knee lacks a straight line of support, but begins to wobble and buckle inward toward your other leg every time you step. This inward collapse places a massive amount of uneven twisting pressure directly on your knee joint, wearing down the protective cartilage over time and causing that familiar, stubborn ache when you try to walk or stand. You see, your knees may not be worn out just because of age. They are simply exhausted from doing the heavy stabilizing work that your side hip was designed to handle. By practicing these slow, controlled side lifts every day, you are not just exercising a muscle. You are sending a clear signal to your brain to wake up this essential anchor. When your side hip is strong, it acts like an automatic guidance system, keeping your hip, knee, and ankle perfectly aligned in a straight, secure line. Walking becomes lighter, stepping becomes safer, and your knees finally get the rest and protection they deserve. Now that we have awakened our hips from the outside, let us talk about how to nourish your joints from the inside. When you experience persistent joint discomfort, it is often a sign of low-grade chronic inflammation happening within the cartilage. Nature provides a wonderful way to assist our bodies through a group of small fruits known as berries. Strawberries, blueberries, and tart cherries are packed with powerful natural pigments called anthocyanins. Medical studies suggest that these specific antioxidants can help lower a key inflammation marker in your blood known as C-reactive protein, or SAR. By reducing these inflammatory signals, berries can help soothe joint irritation over time and decrease the frequency of sudden flare-ups. To get the most protection, always eat the whole fruit fresh or frozen rather than drinking juice. Juicing removes the beneficial fiber and leaves you with concentrated sugar, which can actually increase inflammation. A perfect safe serving is just one small handful, about 50 to 100 grams a day. You can enjoy them as a morning snack or mixed with a little unsweetened plain yogurt. If you have diabetes, keep your portion small, around 50 to 80 grams, and eat them alongside some raw almonds to keep your blood sugar completely steady. If you suffer from gout, eating about 10 fresh cherries a day can help lower uric acid levels. Remember, berries are a beautiful support tool for your body, but they are not a cure-all and do not replace your prescribed anti-inflammatory medications. Think of them as a daily splash of internal lubrication for your moving joints. Now that we have talked about nourishing our joints from within, let us look at a structural tool that keeps us safe, balanced, and independent, the walking cane. Many people feel hesitant to use a cane, thinking it is a sign of weakness, or they use it incorrectly by adjusting it to the wrong height. But using a cane that does not fit your body is a false friend. If your cane is too tall, it forces your shoulder upward, causing tightness in your neck and wrist. If it is too short, you must hunch forward, placing heavy pressure on your lower back and increasing your risk of losing your balance. To ensure your device supports you perfectly, let us use the wrist crease alignment protocol. Stand as tall as you comfortably can, letting your arms hang naturally by your sides. The very top handle of your cane should align exactly with the small crease on the inside of your wrist. When you grip the handle, our elbow should have a soft, relaxed bend of 15 to 30 degrees. This slight angle allows your arm to act as a mechanical shock absorber. Always verify that the base has a thick rubber pad with clear tread to grip smooth surfaces now. Here is the absolute crucial rule for holding your cane. Always carry it in the hand on the opposite side of your painful or weak leg. If your right knee or hip aches, the cane must be held in your left hand. Holding it on the same side is a common error that unbalances your body and overloads your joints. Let us keep our posture steady and prepare to practice our stepping rhythm. Let us practice how to walk with your cane using this precise medical technique. Remember our configuration from the previous section. Your cane is adjusted to your wrist crease and held in the hand opposite your painful leg. If your right knee hurts, the cane is in your left hand. Stand completely tall, relax your shoulders, and look straight ahead rather than staring down at your feet. Now take your first slow step forward. Move your cane and your painful leg forward at the exact same time. Place them down together about 15 to 30 centimeters ahead. As your painful foot meets the floor, gently press your weight down into the handle of the cane. This simple pressing action acts as an external support column, instantly redirecting and eliminating 30% of the mechanical pressure that would otherwise crush your knee cartilage. While treading firmly on the cane, smoothly step your healthy, sound leg forward, passing slightly ahead of the cane. Let us repeat this rhythmic sequence together. Cane and painful foot move forward together, press down lightly, then step your sound foot through. We call this the 3-point fluid gait strategy. For your safety, always practice this inside your home first, with no loose rugs or cords around. Start by taking just 5 to 10 steps at a time, then pause to check your balance. If you feel steady and experience less knee discomfort, you can gradually practice for 5 to 10 minutes a day. Avoid walking too fast or taking steps that are too wide. If you have pain in both knees, use a wider base cane and evenly distribute your weight without leaning heavily to one side. Keep your steps small, smooth, unpredictable. Now that we have practiced moving safely with your cane, there is one more critical layer of protection I want to share with you today, and this one concerns your personal security. Many seniors across the country have reported receiving unexpected phone calls from people claiming to be medical representatives or insurance agents. They might offer to send you a brand new, top-of-the-line knee brace completely for free, or they might pressure you to confirm an order right away. They will tell you your doctor already approved it, or that your benefits are about to expire. But then they will ask for your sensitive information, especially your Medicare number. Please be incredibly careful, because this is a common scam designed to steal your identity and exploit your medical benefits. If you accept these packages, your insurance can be billed incorrectly for unnecessary equipment, which can restrict your future medical rights when you actually need treatment. Medicare will never call you out of the blue to demand personal numbers or offer free unsolicited equipment over the phone. If you receive a call like this, do not give them any details. Simply hang up the phone immediately. If you ever feel you truly need a knee brace or a support device, always consult your own primary care doctor first. You can also verify any official offers by calling the number listed directly on your card. Protecting your health means safeguarding your body, your joints, and your peace of mind. Now that we have completed our active exercises and learned how to fully protect both our physical joints and our personal health information, let us finish our routine with a gentle cool down. Stand completely tall next to your sturdy chair. Relax both arms down by your sides and let your shoulders roll backward in small, slow, soothing circles. Breathe in deeply through your nose, feeling your lungs fill with fresh air, and exhale slowly through your mouth, letting any remaining tightness dissolve away from your hips, lower back, and legs. Let us take one more calm breath together. Your body responds beautifully to these gentle, regular movements rather than intense or exhausting workouts. Remember, you do not need to work harder. You simply need to send the right safe signal to your nervous system. To turn these movements into lasting strength, Try to complete this day 3 routine 3 to 5 times every week, always working strictly within your own comfortable limits. If this session helped you feel a little more upright and stable today, please take a moment to subscribe and like this video so you can easily return to it tomorrow. We will take another professional step forward together into day 4, where we will focus entirely on building your walking endurance and refining your foot movement. Your feet are the literal structural foundation of every step you take, and learning how to articulate them properly will make your movement feel incredibly light, smooth, and secure. Thank you for sharing your time and practice with me today. Keep your alignment tall, keep your steps mindful, and I look forward to guiding you tomorrow for day 4. Have a wonderful, peaceful, and restful day.